Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit consumer-centered organization committed to fulfilling the health and residential needs of the people in the community we serve. I am your host, Jennie Sutherland. Another Zoom meeting, struggling with technology right now, right here. I have from Williamstown Commons two fine colleagues, Jodie Ouimette, the administrator, and Kayla Cloutier, admissions marketing director. Thanks for joining me, ladies.
Thank you.
You are in Williamstown Commons. What is happening there this morning, Jodie?
Well, this morning we're off and about and busy. Census is starting to climb now that we have some relief, from COVID. We have no positive resident cases in the house, which is a good thing since May. We are, we're just working on building our census and trying to work with the new norm. And every week we're just keeping up with the updates with the help of the Home Office and Department of Public Health. And we're just changing with the times. We're just becoming an industry that works with change every single week.
Sure. And I think you hit the nail right on the head there. This is the new norm. So in case folks don't know, we all started out 2020 not expecting this year to look anything like it has. And you certainly, with your team in the community, gone through a lot. So let's just revisit a little bit about that. Again, we're moving forward, and what I want to do is thank you and your team and the community up there for supporting your residents. So I'll let you take it away. And Kayla, if you want to jump in at any time, because you were a big part of that. And so let's hear what happened.
Well, this whole team was a big part of that. We started our year off pretty well. And, as we saw Washington State hitting the papers and China hitting the papers, we didn't want to be in that same boat, and we really didn't expect to see what we did. We volunteered for an infection control survey, which went great. We thought we were in pretty good shape. We really weren't seeing any cases in the county like in February, and then in March we started seeing cases in the county. The beginning of March is when restrictions started to occur around the state, around the country, but particularly in Massachusetts. We had restrictions placed on how we were going to how many people were in the facility at one time, how we were going to screen people and so forth. So that changed how we did things operationally. We introduced Zoom and Skype and FaceTime to people who really had a hard time with technology. So that was a challenge we faced early on. And then in the second week in March, we had our first positive case. And what we did learn during this whole thing is when you have a positive case, you've had someone positive in the building before they show symptoms for a while. And so we just saw that snowball despite our efforts. So with wearing masks, with the mandatory mask usage and decreasing foot traffic in the buildings, closing our doors, as hard as it is, it did help to contain. I think the testing that we're doing now it wasn't occurring in the beginning. It was hard to get supplies, and it wasn't very known what to do next as far as the CDC and DPH. We were all kind of learning together. And I think once we tested everyone and identified and were able to isolate folks, and we grew with our knowledge, with our best practices. We did it as a partnership with the Department of Public Health, which was a good partnership. And we had the support behind the scenes of obtaining all our PPE supplies. We had home office staff who just went to town on that. And, so we really didn't go without. And we were very grateful for that, hearing that, there were other places in the country that were really struggling with that. So As we went on, it was a learning process. Things evolved. We had to shut down communal dining and activities and so forth. And that became a real burden on folks as far as socialization, isolation became, a really an issue. But I think our hardest time was between mid-March and through the beginning of May, when we had cases and upon cases that were already in the building, that we weren't aware of. So I think that was a struggle. I mean, I know it was a struggle. We saw the fear on people's faces. We saw residents who were sick and feeling a little helpless because there wasn't a cure, something you could just give them and make it better. We did learn that, we were pushing hydration and IV fluids and trying to get help, get things that people would eat. People weren't losing taste and smell and not eating. So we really worked as a team. We had staff who were just so dedicated and with cleaning practices, with working many, many hours, and just their biggest concern was not themselves, but making sure that our residents were cared for. And that was heartfelt, and it was really something.
You were one of the first in the state to have to deal with this, right when we were all having to really deal with it affecting all aspects of our lives at the same time.
Yes.
So here you are. And certainly I know that the Department of Public Health, our home office team, all of these folks are supporting you. But we really learned from you guys and how to do things. And you were navigating situations that none of us had ever seen before. So, and the fear in your own lives. I think most of us have jobs and we go to and we work and then we go home and have our home lives. But this pandemic affects every aspect. Kayla, what did you take out of going through that work, being one of the first to deal with it?
Honestly, I think I was mainly, a lot of my coworkers were inspiring because they were working 8-hour shifts and then they were staying the additional 8 hours just to help clean rooms or move rooms or whatever that may be that was needed that day. There was people here from 7 a.m. till 8, 9 o'clock at night. But then there was also some of our aides who went home and didn't see their kids for weeks on end. A lot of people didn't see their kids for weeks on end because they didn't want to affect their children, but yet they still put their job and the residents here ahead of, that home life.
Certainly. Again, we want to thank the two of you, and Jodie, what an incredible leader. And I thank you for what you did, and also for what I saw you do. You were one of those people cleaning rooms at odd times and doing whatever you needed to. Another group of people besides your staff and your residents as well, because a lot of them, did the best they could getting through it. But the community, your community around you, I'm talking about Williamstown, surrounding towns, some folks from Vermont reached out to you. A few from New York State reached out to you. Certainly folks in North Adams did. So I think a shout out to them. Do you want to tell a couple of things about how the community supported you guys?
Yeah, it was very heartwarming with the community, with their support, and there was meals showing up 2-3 times a day, making sure that every shift just had a meal, or sending cards and pictures, and I can't even count how many pictures and cards were sent from kids, and just to put a smile on our residents' face for the day because they weren't seeing anyone. It was really it was great to know that we had the support not only of each other, but people out in the community.
People wrote notes to every single employee, got a personal message from hospice, from, whether it be the Boy Scouts came and to give their support. We had people outside holding signs saying thank you. I mean, when you're really in the midst of it and, busy and running around, and you're feeling this emotion about the whole thing, and you're worried about your residents and you're worried about each other, but people just pulled together no matter what. And to see the community so supportive, I can't even express how that made us feel, and how that made our staff feel. It was very meaningful, and it gave us the, it gave us the hope to go on. It gave us encouragement, and it meant a lot. It did.
Yeah, I mean, I think when you get that, and you've heard this a lot about this COVID, because we have to socially distance and people are curtailing what they do. It's isolating. So you almost felt like you were an island there by yourselves, and that reach out from the community. That was very admirable and very kind. Okay, well, and here we are, because we can't say we're through it. We're not around it yet, but we're going to keep moving forward and taking care of folks. That's what the three of us do. We have chosen this work, and it is helping folks in the community with what the services they need. What does it look like now moving forward? Kayla, what kind of questions do you get from folks, needing some support of a skilled nursing facility? What are you hearing they're thinking about?
So I do hear a lot of still asking about us with the COVID and going over that. So it's nice to be able to tell people, there is no COVID in the building. And the other biggest thing is visits. I understand it's hard. You just can't come and go anymore and, see your loved ones. But we do offer outside visits. We'll be changing eventually to indoor visits. They're still by appointment, but, it's so nice for our residents to be able to see their loved ones. That's probably the biggest question I get, because, right now at the hospital, you can go in for certain hours of the day and eat with your loved one. So that is the difference, but we're just, we're protecting our residents, from any possibilities.
The other thing people need to realize is that is forefront, but we are also regulated and follow the guidance of a couple of governing bodies. So Jodie, why don't you tell folks about this, what that looks like for us?
So we follow the guidelines of the Department of Public Health, which coincides with the CDC. And so we have weekly calls statewide with all nursing facilities in the state, and with our state surveyors, with the head of DPH. And we do, so changes are informative, what the numbers are, where to go for information, and what's coming up, what's changing, what's next. So as we looked at a state reopening plan, as I say, every week there's new news. So we get that new news.
So we have to roll with those. We
do. I think what some people brought to my attention didn't really realize too is when we were when we had positive cases in the house, we were also approached, and we worked closely with the state to accept people from Berkshire County because we were already managing COVID. So we not only had our cases from the inside our house, but we also had them from the community, people who needed care but didn't have a place to go. So some people did come, to get well and went home. Some people came from other facilities in the county, and some people came from the hospital, and some people came from end of life, but they needed someone to take care of them, and this is where we came for that. So moving forward, our new norm, so we do work very closely with Department of Public Health. We're doing testing every week. We have testing going on for our staff and anyone who enters our building to keep people safe and identify cases early on.
Yeah.
So
again, those are good points you brought up. Certainly, it's our what we have promised to the community. I say it in my opening words. We provide the services our community needs, and sometimes those are hard things to provide. And certainly nobody wants COVID anybody to catch it, but those people needed care. And so that was what we needed to do. So you are testing. So let's talk about some of the infection control guardrails you're working with. Testing staff, I think it's like 30 or 50% a week?
It's 50% every other week, so that 100% of your staff is tested every 30 days. So every week we're doing testing, and we're reporting what the number tested and what those results are weekly to the Department of Public Health. What we're doing to keep people safe, we're using, I'm in my office alone, but we have masks and goggles that we're using throughout the house as part of, for everyone, on the units. We do have protocols for if we've had a case in 14 days or not in the last 14, there are protocols. We've contracted with company for gowns, so we have an endless supply of laundered gowns, and so we won't run out when it comes, if and when we have a second wave that comes and we're worried about supplies. We are stockpiling supplies for a few months down the road, so we've made stock room just for COVID and just for PPE and cleaning products, so that we make sure that we have what kills the germ, and what protects us from it at all times. So we've done pretty well with that, and we're constantly reminding staff, re-educating every week as changes come out, and we're temping people at the door and checking for signs and symptoms.
When they come in, people are helping them into their rooms and stuff. The family can't really go in there anymore. So we try to do and keep it as it was in the past, but team members are doing that, probably yourself included. Any thoughts on that? How the admissions coming in? I know they're talking about COVID with you.
Yeah, so the admissions process is a little bit different. Normally families would come in and help get them settled in their rooms. So we're doing the best we can to make up for that. There are some instances when family just wanted to see where they are. I do offer, and we do FaceTime videos of the room just so they can kind of get a feel for, where the resident is and where, their mom or their dad might be for, their duration here, just so they can kind of get a sense and a feel for the building. I have done virtual tours, so that's always available to do FaceTime that way. We have the ability to Zoom or Skype or all of those things. So, once they get settled, I always tell the families they can set up a Zoom meeting or a Skype meeting through our activities so that they can, see how their parent or their loved one might be doing.
So I think that's wonderful. I hope more people take advantage of that. And so that's good. They can do, while weather permits, outdoor visits scheduled. Yes.
Yes.
Are they still doing window visits?
Yep, there are still families that do window visits, and we still do the occasional balcony visit for upstairs residents who, you can't just go to their window. So
like the Romeo and Juliet thing?
Right. So we do a little bit of that as well. We actually have a family who is planning to do a drive-by parade by their loved one's window, which I think is exciting for their birthday.
I think we're all used to all the things we can't do, but it's good to think about the things we can do. And so, Jodie, is there other opportunities? What's video chatting? Probably, I could never do it myself, clearly, but...
So we sent months ago, we sent out mailings about how to get on Skype, how to do FaceTime, that sort of thing. And our activities department schedules and coordinates visits, and they help the resident facilitate it, and they help the family facilitate it as well if that's what they'd like. And that is the preferred method, because you can see someone from the safety of your indoors and the warmth of your indoors. That is an option that does get used frequently, which is a good thing. And with some of the opening up of indoor visits with restrictions, near the lobby, there's, temping people and screening people before residents are brought down to visit. So we are scheduling, we've now just begun to schedule indoor visits, but they are limited. So it's by appointment. Yeah. We're still keeping social distance.
And I hope people can understand the importance of we have to follow guardrails. Plus, we're trying to make the best decisions to keep people safe. It's not to be meanies or whatever. Certainly, I think people can appreciate that. So there's video conferencing scheduled, some visits scheduled outside, window visits, and I think you've had some window entertainers go around. Yeah. So that's great. A little shout out to their activity team there at Williamstown Commons, Marjorie and her team doing that work. So thank you. And other staff pitch in as well. So that's a group effort to make that happen. And all of this is based on while we can and as long as we can. So again, something you guys have mastered is flexibility, and it has been kind of forced upon you, but I think you guys can just kind of roll with things more than you've ever been able to, yes?
Oh yeah, most definitely.
We're master movers. When we need to, it's all hands on deck, and there is no, this is my job, that's your job. No,
that's out the door.
The attitude people have is a positive one, where they just chip in wherever needed, and that's been a great thing for teamwork.
Kayla, if folks want to get some information about Williamstown Commons, how would they go about that?
They could definitely reach out to me, and they could give me a call at our main number, which is 458-2111, extension 245. And anytime they have questions, we can go over things. I'd be happy to mail out some information to them as well. Every situation is different, so we could go over that at that time.
Sure. And you have a Facebook page and a website to get information too?
Yes, we do. So you can follow us on Facebook. You can see all the different activities we do, all the different events we have, or you can write to us on our website.
Okay. And you can get information that way from the website?
Correct.
All right. So as far as, and again, in the skilled nursing facility world, we have long-term residents. Are you seeing some folks needing that support?
Yeah, we've had quite a few long-terms come in. We do offer a dementia-friendly unit here, so that's tends to be a popular unit of this building for long-term care. We also have a lot of short-term rehab residents that have come in lately, just needing some therapy, some physical therapy or some occupational therapy to get back to where they were before they were sick, to get them home. And of course, we're always here in the future if they were to need us again.
Yeah. Are you still seeing folks having some elective surgeries and things like that?
Yeah, so for a while we didn't. It had all stopped. As you can imagine why. But it has started back up again. So we have had, hip replacements happening. All sorts of different electives are starting back up again. So that's been a nice change. Yeah. We can get these people better at home.
Yeah. So a couple of opportunities is where we're at now. It's still good to do some of the surgeries people might have put off. Sometimes people have to have surgeries because of circumstances. And Jodie, so the idea of coming in for a short-term stay can be frightening, but again, your hope is to get them back home as quick as possible for your short-termers. So I think people are like, oh, no, that's not their goal. It's to keep me. So why don't you dispel that myth?
So I got to tell you, the therapist in me, and I'm a PTA, my passion is to get people well and get them home. And I get really excited to go home.
Yep, I know.
And that's what they want to do, and that's a good thing. So we have quite a few people who come and go. We have quite a volume of in and out of people that come in for short-term rehab. We have a very good rehab team. Our social services department helps set up services to make that a successful discharge. So when they go home, they stay home with good success. We do education so that for self-care, so that people can learn what they need to do to go home and have good outcomes. We do schedule our follow-up visits with the physician out in the community before they go. We have VNA follow folks when they go home. So there's a lot of pieces and parts that go into place when about getting people home, getting them home timely, and getting them home safely. So that is a good thing. When people come in, they're in an environment where they're under quarantine initially in all nursing homes across the state.
Mm-hmm.
So when you come in, there's not that fear. I feel safer coming here than I do going to the grocery store because I know everyone's wearing their PPE, that they're constantly doing hand hygiene, that we are doing specific protocols for new admissions, for anybody suspected that there's frequent testing. So I feel really good about where we're at here. And what we try to tell families is, I know that nursing homes are the vulnerable population because of the sheer demographics who lives in a nursing facility. But this is why numbers really dropped, because we learned about it, and we learned how to keep people safe, and we learned how to work on prevention, and we know a little bit more about this invisible enemy, if you will. I don't know.
No, that was, I mean, it is, to me, it's your personal enemy, Jodie. I mean, this is just amazing to go through this, and I'm sorry, but what you guys went through, our organization learned from it. So again, thank you for that. So we have a couple of minutes here. Kayla, one more time, if they want to talk to you, give that phone number.
You can reach me at 458-2111.
All right. So I'm going to ask you both the same question, and we'll start with Kayla first. Out of so far, because again, we're not over this, so far, what have you learned out of working in this industry during this time?
Honestly, I've learned a lot of things, but I think the biggest thing is teamwork is everything. I mean, I always was a huge fan of teamwork, but after this, if we didn't have the team, we wouldn't have made it through.
All right. Well, thank you, Kayla, for coming on. Thank you to your team. Jodie, over to you. Something you have gotten out of this so far?
People come together in times of crisis, that, people step up to the plate. They really do. And adaptability with something that's unknown is important. So we just need to be flexible and roll with the times and keep learning from it and keep adjusting. And change is okay. We'll be okay. We'll be okay.
Thank you both for coming on the show with me today. I want to thank the folks for tuning in and watching. InfoSource is a presentation of Berkshire Healthcare Systems. Until next time, I wish you good health, good life. Bye-bye for now.